The U.S. Supreme Court will hear arguments on Monday challenging the constitutionality of a provision in the Affordable Care Act that requires most private health insurance plans to cover preventive care at no cost to the patient. As Laura Barone Lopez reports, the case could have a profound impact on the health care millions of Americans use to stay healthy and prevent disease.
Attorney and queer activist Preston Mitchum has been taking pre-exposure prophylaxis, or PrEP, to prevent HIV every day for about a decade.
Just being able to wake up and have a peace of mind has to be the number one benefit for me about why I still take it.
PrEP reduces the risk of getting HIV from sex by about 99% and from injection drug use by at least 74%.
For me, there's always going to be a benefit to understanding what you need for your body to be healthy. I know it's really important for me to protect my body, and not only my body, my partner's bodies along the way.
The medication was first approved in 2012 and is now available in two forms:
1, 2.
a shot every other month or a daily pill.
PrEP and preventative care is kind of the cornerstone of what we do here at Whitman Walker.
Dr. Kyle Benda is a director of medical operations at Whitman Walker Health, a nonprofit in Washington, D.C. that offers primary care and specializes in HIV treatment. He credits PrEP with helping to reduce new cases of HIV in the nation's capital by 12% from 2012 to 2021.
While our HIV treatments are amazing and life with HIV is very different than I think what a lot of folks may think of, for the health of our population, prevention of HIV is paramount.
Still, the cost of the drug is so high that without financial help, for most people like Preston Mitchum, PrEP would be out of reach.
When I first got the actual prescription and they rang it up, it shot up. It was like $2,000, $2,100. I was like, there's no way I can afford this. No way.
But since 2021, because of a provision in the Affordable Care Act, Mitchum's insurer and almost all health plans have been required to fully cover the cost of PrEP, which can total up to $30,000 a year. Soon, that could change. The Supreme Court will hear arguments Monday in a case that could eliminate not just free access to PrEP, but cost-free access to at least 24 other preventative healthcare treatments.
Millions and millions of people would be impacted. These incredibly popular but potentially under-the-radar services like mental health screenings, cancer screenings, cardiovascular, GI conditions will all be impacted if the Supreme Court rules that health plans no longer have to cover these services 100% without out-of-pocket expenditures.
Medical professor Dr. Mark Fendrick helped draft the preventative care provision in the Affordable Care Act, now at the center of this case.
We noticed that when Americans had to pay more for everything, we saw that lots and lots of people were deferring essential preventive services because they had to pay large amounts of out-of-pocket costs.
The original suit was brought by 2 Christian-owned businesses and 6 people in Texas, who argued that covering PrEP in their health plans conflicts with their religious beliefs, claiming the drugs, quote, facilitate and encourage homosexual behavior, prostitution, sexual promiscuity, and intravenous drug use.
This lawsuit is part of a much broader pattern of challenging the Affordable Care Act that stretches back to the moment that it was signed.
Nicholas Bagley is a law professor at the University of Michigan who has followed the case. He says in 2022, the plaintiffs were granted religious exemptions and no longer have to provide PrEP under their insurance plans. What the Supreme Court will now consider goes beyond religious freedom arguments and could have a much larger impact. The businesses and conservative Christians who filed the lawsuit also want to get rid of the preventative care requirement altogether.
They believe very deeply in religious freedom and are aligned with conservative causes, and so are using this as an effort to push back on what they see as the excesses of the Affordable Care Act.
But Dr. Fendrick warns that would have devastating consequences on American healthcare. Under the ACA, a task force made up of 16 medical experts decides which preventative care services must be fully covered by most private insurance plans.
One of the strengths of using the U.S. Preventive Services Task Force is, in fact, they are an independent body. They are very, very deeply vetted, and they have expertise in clinical medicine, preventive screenings, population health. These are the folks that I, at least, would like to be seeing making the decisions based on science and available evidence to determine what are those preventive services that should be covered at no cost to patients.
But Thomas Berry of the Libertarian Cato Institute believes that the task force is unconstitutional because its members are selected by the Secretary of Health and Human Services instead of nominated by the President and confirmed by the Senate.
In a democracy where we elect a president, where we have a presidential election that pits two competing ideologies against each other, ultimately the people have to have some say in the final decisions.
He wrote an amicus brief supporting the Texas businesses and individuals who brought the suit. Berry argues the task force makes rules without public accountability, and that all of the healthcare coverage it's mandated since passage of the Affordable Care Act in 2010 should be rolled back.
Ultimately, the president has to have a clear line of authority to every other decision maker within the executive branch. If you have that bright line rule, the public can blame the one person that they had an opportunity to vote for, which is the president.
If the Supreme Court disagrees with that argument and decides the HHS secretary can continue to control task force membership, Nicholas Bagley says that will likely mean that Secretary Robert F. Kennedy Jr. will have more control over what exactly is covered by private insurance.
If the secretary wins this case, it's going to be because the court holds that he's got a great deal of control over this body. And especially given his idiosyncratic, at best, beliefs about medicine and about the best kind of medical care, we have reason to wonder how he's going to exercise that authority and whether he's going to appoint people who are very far outside the medical mainstream.
2 procedures, PrEP patient.
Back in Washington, D.C., Dr. Benda is already bracing for the possibility that his patients may soon be paying for preventative care out of pocket, if they can afford it.
Ultimately, what do you think is the biggest risk if PrEP or other preventative care is no longer fully covered?
I think our greatest risk is of increased HIV and increased risk of chronic disease and a decrease in patient life expectancy, an increase in our cost associated with taking care of folks with chronic disease. Our patients won't be able to live longer, healthier lives.
The justices will decide this latest challenge to the Affordable Care Act and the future of healthcare access for patients across the country by this summer. For the PBS NewsHour, I'm Laura Barone Lopez in Washington, D.C.